Let's talk about the 7 key areas you need to know to pass the NCLEX exam in 85 questions. Right. So this is my goal for you. In order to pass the NCLEX exam in 85 questions. So when we know these 7 key areas, then you should be able to pass the NCLEX exam in 85 questions. Right. So I'll walk you through because we are going to see those key areas on the NCLEX test plan. Right. So I'm going to walk you through the NCLEX test plan. Right. So the NCLEX test plan for RN and as well the NCLEX test plan for what? PN. So let's do that real quick. So first document, this is for the RN. So you can see this, right? Distribution of content for the NCLEX-RN test plan, right? So you can see that distribution of content. So now the RN have what? 146 content. So all the 146 content are distributed across these 8 client needs. If you've heard me many times, I mentioned what the 8 client need. Now let me explain again the 8 client need so that you can understand. Now, this is the NCLEX mindset. The NCLEX know that what you have is what nursing school knowledge. Now, NCLEX don't want to test you on all your knowledge. They just want to test you on what specific knowledge, right? Those specific knowledge are the RN 146 content and then the PN 150 content. Right. But knowing all this content, NCLEX want to see if you can use those content to what? Practice and show that what? You are a safe nurse. Now, those practice, right, is what we call the 8 client needs. Because now, in order to show that you can practice, right, you cannot just go, it's just like now, you cannot just go and say, you start working as a nurse today and then you just want to, because obviously you are a registered nurse, you just want to do anything. No, you need to understand the way they practice in that particular unit, right? Despite the fact you are a registered nurse. That is the same way you need to know the 8 client need, right? Yes, you need to know the 8 client need because you need to identify, okay, this particular question is a management of care question. So because it's a management of care question, this is how we should answer this kind of question. Oh, this is a safety and infection control question. So because this is a safety and infection control question, this is how we should answer these questions. Right, this is reduction of risk, right? The name of those client need, right? Those client need area or category. Those client, it can either be the client need or category. You can call it the 8 category or 8 client need, right? Area of client need. So now you know them, you can easily say, okay, like if you are to answer safety and infection control question now, if you see a safety and infection control question, you need to use the principle of safety and infection control to answer the question. Like now, if a patient have chickenpox, and another, if a patient, this patient have what? Chickenpox, and another patient have hypertension. They both have a specific condition, but guess what? You are going to use safety and infection control to answer this, and you are going to use your medical condition approach of answering what this. Right. So both might ask you for intervention. NCLEX might ask you for intervention for both, but your intervention here will be related to what? Safety and infection control. Your intervention here will be related to what? Medical condition, right? Because right here, you cannot be isolating this client. They have hypertension. Instead, you might likely be what? Doing assessment, giving medication, right? Procedure, you know. But for chickenpox, guess what? The first initial thing that comes to mind is what? Isolation, because that's what we want to do, right? That is how we answer what? Safety and infection control question. You can see how it works, right? That is because now you cannot go on the NCLEX exam and start saying, oh, this patient have chickenpox. Is the NCLEX wanting us to treat the patient? right? If you are thinking like that, then you don't know how to answer category specific question when you see it on the NCLEX exam. Because one, the question you should be when you see your question on the NCLEX exam, you should be able to group it into a specific category so that it give you that strong thinking process to now say, okay, if this is a reduction of risk question, then there's a specific risk that is going to happen to this patient that we are trying to avoid. So let me look for that answer that help us to avoid that specific risk. Makes sense, right? So yeah, in my course program, I really teach all this, right? So let me not go deep into that. But that is how you know the eighth client need. And the other aspect is the sixth concept. That is how NCLEX tests to see if you are a safe nurse. Right. To see if you are a safe nurse, NCLEX use what? The sixth concept. Right. So there are a lot you can see. Now, if you've taken the NCLEX exam before and you don't know what this, then it means that when you were taking that exam, you were gambling through it. Right. They are not difficult things. They are things you knew in nursing school. But the thing is that you did not utilize those knowledge right appropriately when you were taking the NCLEX exam. But now you are going to utilize it well. Right. Because I'm going to walk you through. Now, so we have the eight client needs. So if you look at it, let's count it. 1, 2, 3, 4, 5, 6, 7, 8. Right. Let's go on the PN document. It's also 8 on the PN document. So this is the PN document. You can see. So now we have 1, 2, 3, 4, 5, 6, 7, 8. Now remember we are talking about distribution of content. Now the PN have 150 content, the RN have 146 content. Now look at the distribution. So we have 21% of this 150 content distributed to what? Coordinated care. So in your NCLEX exam, you should expect question from this area the most, 21%. That's the reason why when I focus on this area with a lot of students, they end up passing the NCLEX exam in 85 questions because this 21% out of 100%, that's a lot, right? Safety and infection control, 13%. We have 9% for health promotion, 12% for psychosocial integrity, 10% for basic care and comfort, 13 for pharmacology, 12 for reduction of risk potential, and then 10 for physiological adaptation. Now, the reason why a lot of students fail the NCLEX exam is that they pay attention to those low areas. I've seen students, they will say, oh, I struggle with med-surg. Guess what? No, not yeah. People struggle with med-surg. That's physiological adaptation. That's 10%. Right. I wanted to say maternity before. Let's say I struggle with maternity. I struggle with pediatrics. That's 9%. So that is 19% of the exam. Now they go all in those areas. They study their med-surg, they study their maternity, they study their pediatric. Now when they go, not knowing to them because you don't know the test plan. So you don't know you are not studying right. Because studying med-surg, which is under physiological adaptation, studying maternity and ped, that's 9%. So meaning you study for 30, 60, 19 days, you only acquire what? 19% knowledge. So now when you go on the NCLEX exam and you fail, then you are surprised. You are worried, you are concerned. And guess what? If you go and check the NCLEX pass rate, you will see what I am saying. It reflects what I am saying. Because only this year, 2025, January to March, people that repeated the NCLEX exam, because I don't focus on people that pass the NCLEX exam for the first time, right? I coach students who who are taking the NCLEX exam for the first time. But what I'm trying to say is that when I always used to check the NCLEX pass rate, right? I don't focus on people that took the NCLEX exam the first time because it's always between 85 all the way to 95% pass rate. But guess what? People that repeat the NCLEX exam, RON is always 51% or anything 56%. Let me say 51 to 56% pass rate for people that are repeating the NCLEX exam. Now for PN is even terrible, right? 38%. Sometimes it goes all the way to 37%. Right. So imagine you can see there's problem with people who are failing the NCLEX exam. And guess what? These students, they are not trying to understand why they are failing the exam. Instead, what they are doing is to jump from one question bank to another. Now, I've seen a particular student who failed the NCLEX exam. What? I've seen a particular student who failed the NCLEX exam 7 times. Now, she did a lot of program. Now, guess what? Let us say each of those programs have 1,000 question bank. Multiply by 7. That is 7,000 question bank in order to answer 85 to 150 NCLEX question. And you are telling me after 7,000 questions, that student is unable to pass what? On her 8th attempt. And she still failed on her 8th attempt. So it's not about the question bank. That's why I always used to say, don't skip process, right? You need to understand the NCLEX plan and then study. That is how it works. Understand the NCLEX plan, study. If you don't understand the NCLEX exam, you might now you ask some certain student, what do you think went wrong? Say it's because I don't really know med-surg. There are a lot of disease condition that came out on the exam. Guess what? It's just 10% on the exam, so it's not possible to have a lot of disease condition. NCLEX describe patients by their condition, but they might not be testing about their condition. Like a particular question is testing about was talking about a patient who have diabetes, but they said a patient who have diabetes, and when the nurse saw the patient started complaining about self administration of what? Insulin medication. So now, is the NCLEX testing anything about what? The diabetes? No. Is the NCLEX testing anything about the insulin administration? No. Right. Because the patient was only complaining, right? Right. Feeling sad about administering what? The medication to themselves all the time. Right. They feel pain about it. So that particular question only need what? Interaction, therapeutic communication to solve that particular question. You are not giving any treatment, you are not doing anything. Right. For that particular question. But guess what? Because you saw the question of what? Diabetes, automatically you are thinking that question is testing you on diabetes. But no. Because you saw insulin, you are thinking the question is testing you on insulin. But no. That's the reason why you need to understand the NCLEX. Because when you understand the NCLEX, you will find out that, oh, so every med-surg that I was thinking was med-surg question, they were just trying to describe the patient. There was a particular question I saw in the NCLEX exam, right, that said a particular patient was admitted, right, and they wanted to carry various tests. NCLEX listed almost 7 tests, right, and the patient asked one question: why do I have to go through all these tests? I only came what? With a fractured leg. And guess what? A lot of students might be thinking about, what is this test used for? What is this test used for? What is this test used for? But guess what? NCLEX is not testing you on those tests. Instead, NCLEX is testing you on what? Your ability to give what? Therapeutic communication. That's what NCLEX is testing you. Now, there's a trick to that, right? But we are not about to talk about that. Now, let's just go straight to the thinking. So this is what happened, why a lot of students fail the NCLEX exam many of the time. Right. This is why a lot of students fail the NCLEX exam many of the time, because they don't understand the NCLEX. Now, I said I'm going to show you the 7 key area, right? You need to know. Now, let us do the math together so that we can know the key area. Let's do the math together. Now, look at this 21%, right? Then let's look for the next one. This is 13, right? And then let's look for this area, right? So now we have 1, 2, 3, 4, 5. So let's do the math. We have 21%, we have 26, because this 2 is 26, and then we have 24. So this 2 is 50 plus this, then we have 71%. Now, guess what? If you study this 5 area, you are 71% ready to pass the NCLEX exam. Right. Your whole exam is 100%, and you only need 51% to pass the exam, because that 1% will put you above the passing standard. But guess what? We have 71% just studying 1, 2, 3, 4, 5. So we are ready to pass. Now, what's the additional 2? That is your bow tie, because you cannot escape that, and your case study. Right. I always used to tell my students this. I prefer to have 85 case study and bow tie question on my exam. Why? Because I'm very good with it. Right. I'm very good with it. So, yeah, because it's nursing process, understand? So, and question like this, the answers are already in the case study. You just need to critically think through the case study and like pick out all the answers. Right. Be smart about it. So that's how both tie and case study work. Right. So I prefer to have 85 questions, right? So if you can know these two parts, right? In addition to what? The 5 other area, that is 7 key area that will help you to pass the NCLEX exam in 85 question, right? If you are taking the NCLEX PN, right? So let's go and check the key area we have what? Right on what? The NCLEX-RN. Now, you can see right here, same explanation previously before, right? A lot of students will pay attention to what? The lowest area. Now, if you look at it, 9%, 9%, 9%, that is what? 27%. Now, students will say, oh, I struggle with med-surg. This is med-surg, 41%. I struggle with maternity and peds. This is it right here, 9%. That's 23%. Is 23% enough to make you pass the NCLEX exam? No. A lot of students struggle with pharmacology as well too, but they ignore it. They feel like they know a lot in order to pass the exam. Right. Now, let me tell you something about question bank. Question bank only give you question. You are only thinking about completing all the 2,000 question or 2,000 plus question, right? You are not thinking about how the NCLEX work. So that's the reason why when after even studying thousands of questions, you go on the NCLEX exam and you still feel lost because you don't understand the NCLEX exam. Now, if it's that you understand the NCLEX, then you utilize question bank. I'm telling you, your eyes will open immediately. You will now find out that your 2,000 question, maybe just 500 were only useful, because you are going to find out that most questions I've gotten every program, name it, right? When I was taking the NCLEX exam, I never use any program to pass. I only use what? The NCLEX test plan, question, past question, and I listened to few videos on YouTube, and that was it, right? Because I understand the NCLEX exam, so I was able to what? Take the process from there, right? But yes, a lot of students need somebody, right, to guide them, hold them by the hand, walk them through. Because trust me, when I was doing it myself, I was frustrated, worried, anxiety, not confidence. My way was just like this before I knew how to navigate it. Right. It took me 5 months before I knew how to navigate it. Right. And trust me, if you tell students now, all right, let's prepare for the NCLEX exam in the next 9 months, they cannot do that. Let's prepare for the NCLEX exam in the next 5 months. They will say, oh, I need to do it. I've set my date. You understand? If I can do it in the next 45 days, I will be glad. Right. A lot of students want to take the NCLEX exam very fast. Right. So if you're that particular type of student, you need somebody to walk you through so that at least you can shortcut this whole process instead of like feeling lost. Right. Because now, in the process of studying, right, trust me, I started my studying right from January, right? As at November, I am still studying because I don't want to go and take an exam. I don't understand. I'm trying to understand it. Now, it took me 6 months to understand fluid and electrolyte. 6 months. I was like, how will I know this? How will I know this? I crammed, I learned mnemonics. That's the reason why till today I don't teach mnemonics, because I hate mnemonics. Because it's not working for me. Right. I learn mnemonics, I learn because I don't like doing cramming. I hate to cram. I like to understand. Right. So I was like, this and that, this and that. Right. That was when, through my understanding, or the way I try to understand fluid and electrolyte, that was the breakthrough for my studying. Because from fluid and electrolyte, I was able to understand that I need to break my studying into portion. Because I was trying to know about fluid, I was trying to know about each electrolyte, I was trying to know the normal range, I was trying to know the sign and symptom, I was trying to know the treatment all in one time. Nah, you can't do this. You can't. So instead, I was like, for 7 days, right, I want to study what? All this. So I broke them into parts. Now, the first part is to understand fluid. Then I started understanding fluid because fluid is deep, right? As fluid is good, some patients will not need fluid, and some patients will need fluid. Patients that have fluid overload will not need fluid, but patients that are dehydrated, low blood pressure, they definitely need fluid. You need to understand, not only understanding those patients, you need to understand why they would need fluid and why they will not need fluid. At that point, you also need to understand the type of IV fluid we have and In what occasion do we use them? Lactated ringer for resuscitation for patients that have severe burn, right? Or patient that is severely dehydrated. You need to now know your normal saline, your isotonic, hypotonic, hypertonic, because why a patient with SIDH don't need fluid, they might have low electrolyte. You need to know the specific fluid to give that particular patient to replace their electrolyte level or low sodium they have. Right. So these are things you definitely need to know about fluid. And that was what I was trying to learn all in one time. It's not possible. So I knew fluid. I skipped that process. Now, the electrolyte, we have in nursing school, I knew about 6 electrolyte. Now, when I did my analysis of over 1,940 questions, I noticed NCLEX just tests 4 electrolyte. Your calcium, sodium, potassium, magnesium. That is all. So at that point, I knew that, and I was only studying what? Just the normal range. I was not even finding out the sign and symptom. I was just studying the normal range and their use, right? What I was studying was the normal range and a specific complication. That was when I knew, okay, potassium is for the heart, sodium is for the neuro, right? Magnesium, calcium, right? Can work with calcium for the bone, magnesium for muscle, right? So these are things I knew. You understand? So now, knowing all these particular things, now that way I was prepared for what? The sign and symptom. And I was prepared for everything, right? So that was what I was doing. Right. That was what I was doing. And this way I was prepared for what? Intervention. So I know if a patient have low potassium or increased high potassium, I know, okay, we need to give what? We need to do cardiac monitor. We need to what? Give calcium gluconate and then give your insulin. So that was how I was learning it. What about sodium? Same thing. So a patient that have low sodium, you instantly what? Need to what? Prepare for what? Seizure precaution, because patients are treated for seizure. That's the initial action. Right. You understand? So a lot, right? I don't want to go into all that because we are talking about what? The 5 area. So I'm just putting this out there for people that are struggling with studying, right? They should know. Right. Now, this area, 27%, but look at all this area, right? Management of care, this, all this area, there are 1, 2, 3, 4, 5. That is what? 73% of the exam. So imagine 73% of the exam for RN. You are going to pass in 85 questions. You also know what? Your bow tie and then your case study. Then you pass as well to 85 questions. It's not difficult. NCLEX is not difficult. Now, this is what I tell my students. NCLEX is very difficult to fail. Right. It's very difficult to fail NCLEX exam. NCLEX made it possible that it's very difficult. Now, let me explain how. Now, a lot of students are worried about what content will be tested on the NCLEX exam. NCLEX gave you the content. That is one. Now, what is your next thinking? Yeah, we're one student, right? So what is your next thinking? What question will be tested? Now, NCLEX gave you past questions that were previously tested on the NCLEX exam, right? Past question. Let me just say past. Let me write. But let me not use question bank. Let me say past question, right? So that people will not think external question bank like Asha U Word Bootcamp. I'm talking about past question related to the NCLEX exam themselves, right? So content, past question, right? So now, what do you need again? To be answering question, to be testing your knowledge. That is all you need. Right, that's all you need. But guess what? NCLEX did not stop right here. Instead, they still rated the CAT to match your knowledge. Unbelievable. In nursing school, if nursing school will give you 50 questions, right? We expect the best students in nursing school, right, to score to get grade A. Right? We expect the best student in nursing school to have grade A. But guess what? That's not NCLEX work. NCLEX want everybody to have what? Grade A, which grade A equal what? Pass on the NCLEX exam. NCLEX don't use grade. NCLEX don't use A, B, C. No, NCLEX don't use that. If you pass, pass is pass. Right? NCLEX don't use score. NCLEX don't use anything like that. So pass is pass. So if you pass, that is grade A. Let's say it like that. Now, NCLEX want to test individual separately. So NCLEX is not testing everybody the same way. NCLEX is like going to like walk you through each and every question to end up finding out the specific knowledge you have. You see how NCLEX is very awesome. Now, NCLEX don't just give you questions. Instead, NCLEX will give you the first question, and then they will look at it and they will say, okay, this particular student got this question wrong. Let us look for another question that this student can get correctly. You can see that as smart. But if in nursing school, if you answer your 50 question, right, that is it. There's no changing. You cannot say, oh, lecturer, this question is difficult for me. Please give me another question. No, you are going to do it. Right. But on the NCLEX exam, you can answer one question. You don't even need to tell the NCLEX to give you the next question to be very easy, right? Or less challenging. The next question, if you get this wrong, NCLEX is going to give you the next question that will be less challenging. That will be what? Easy for you to answer. And along the line, NCLEX is trying to know your knowledge base. If NCLEX find out that this student is always good in prioritization, NCLEX will be giving you a lot of prioritization questions to boost up your passing standard, because NCLEX wants you to be above the passing standard. So it makes no sense NCLEX will be giving you questions you don't know. And the whole goal of NCLEX is not to make you fail. The whole goal of NCLEX is not to find out what question you don't know. Instead, the whole goal of the NCLEX is to find out what you know, so that they can test you on those areas to see if you are a safe nurse. That is the whole goal of the NCLEX. NCLEX is not there to punish you because you did not do well in nursing school. No, not because you did not study so well. No, that is not NCLEX. NCLEX is not looking for the best student. NCLEX is looking for the ready to be nurse. And to be a nurse, you need to be able to what? Know the necessary thing you need to know. And the NCLEX has given that. That's the reason why NCLEX provided the content, right? And they provided you past question. Now, NCLEX believe at this point you are ready to what? Become a nurse. So think about it this way. At the end of 85 questions, you are already a nurse. So at this time, you need to give it what it takes, right? You need to give it what it takes. I've been explaining a lot about the NCLEX, right? If you are following through, then for sure you should be able to pass the NCLEX exam in 85 questions. Guaranteed, right? Guaranteed. So you are paying attention to what? Those 5 key areas, and then the other 2 areas, which is bow tie and case study, and you are passing in 85 questions. Now, last thing we are going to do is I'll walk you through the content. You can see the content for management of care. Like, we already know management of care is part of the category, date cleansing. Now, in order to be above the passing standard, you can see it right here. You can see it right here. Look how the content NCLEX is testing. Right. You can see all the content. Now, when you study all this content, it's not possible. You can never be below the passing standard or have near the passing standard. Safety and infection control, same thing. You can see health promotion. You can see psychosocial integrity. All the content is there. NCLEX is not hiding anything from you. So if you are failing the NCLEX exam, there's a big problem, and you need to fix that. You need to fix that. Right. Seek for help. You need help. Right. So now, look at for PN as well too. Look at for PN. Look at the content for coordinated care. Everything is all there. And this is what the CAT is going to give to you. It has been programmed already for the CAT to give you this. So nothing can change. Right. So this is what is going to come out on the NCLEX exam. You just need to know what to study. Now, the reason why a lot of students run away from the test plan is that their complaint is, oh, it just only indicates what you need to study, but I don't have where to study for it. That is why my program is available, because I have all these things covered. Right. And not only I have the content covered, I also have how the NCLEX test you on each of these content. So the moment you understand the content and you know how the NCLEX tests you, you are going to see that same thing on the NCLEX exam, and you'll be able to answer the question and pass in 85 questions. This is the secret behind why many of my students pass the NCLEX exam in 85 questions. Right, you can see it. Everything is all there.